Hey everyone, Dr. Boris Nektalov. I'd like to show you an MRI of pretty severe condition of herniated disc in the spine of the lower back. Before I'm gonna do that, I want to show you what normal looks like so you can understand when we're looking at abnormal. So this is a normal spine looking from the side view. The first thing I look for is the curvature of the spine, which is good. Then I look at the spinal cord, which is inside spinal canal. We're looking at the white, which is spinal fluid on MRI. Anything that's fluid looks white. Then the next thing I'm looking at is the disc bases. How do they look? They apart from each bone of the vertebra. Then I'm looking at what's going on to the disc, because the disc itself is 90% fluid. So what's happening here, a healthy disc looks white, just like this. And the very last thing that I look at is there space between the spinal cord and the spine, the vertebrae, the spine and the disc. Anything that's coming out from this area that can protrude and compress into the spinal cord or the nerves that can cause the pressure and the pain. Now we're going to be looking at the abnormal, very severe, which is there's a lot of stenosis I'm going to show you and explain to you. First thing we're looking at is what? There is no curvature, completely straight. The reason why we have to have a curve is to absorb gravitational pressure throughout the spine. Second is I'm looking at the disc spaces. They're very compressed. If you can see that they all are black, they are dehydrated. This took years to develop. This doesn't come overnight. And people often think, oh, I don't have pain, that means everything is okay. And then all of a sudden it starts. And then I'm looking at the spinal cord that sits inside the spinal canal. Then when we're looking at you see these protrusions right here? They're completely coming out and they're compressing that spinal cord. If you pay attention in this area, which is 5, 4, 3, this is L2 and L1. Specifically L2 level is there's a ligamentum flavum from the behind and they're completely compressing that spinal cord. This person, I bet, is having severe pain. Unfortunately, this is not a chiropractic case. I strongly recommend this person to see an orthopedic surgeon or a spinal surgeon. If you are facing surgery and you want to see a second opinion, if anything can be done to avoid, reach out to us so we can review the MRI together and let you know if chiropractically can we help you or not.